Hi, I'm Joya Vanderlaan. I'm a functional medicine family nurse practitioner and owner and practitioner here at Nourish House Calls. Today I wanted to talk a little bit more about regenerative medicine and how does that work? There's often in the media, talk about how these stem cells that are injected into us are turning themselves into our actual tissue. Did you know that's not actually how it works? Let me tell you about what these regenerative therapies are and how they actually work. So we want to understand what these cells, what these injections are, and how they work. There are a few different types, which can make it really confusing when you go to try and research this stuff online. So let me tell you the options. Depending on where you go, you may have different options. For us at Nourish House Calls, we use product from live births, either harvested from the amniotic fluid of healthy C-section births or the Wharton's jelly from the umbilical cords of healthy C-section births. Other places will harvest your fat or your bone marrow, which can be a traumatic procedure, as you might imagine, and they use your own cells, your own old, maybe not quite so likely to replicate inside of you cells or cause replication inside of you cells. One of the best arguments that I've heard for using birth tissue, so amniotic fluid and umbilical cord Wharton's jelly product, is that we're not harvesting from the patient, creating an inflammation. We know that these injections and the healing factors are drawn towards sites of inflammation. So one of the best arguments I've heard, and I agree with, is if we're going into your hip or into your belly to get fat cells, we're creating an inflammatory response. Then when we go to inject your product, some of those cells, some of that healing action is actually going to be sucked up by the sites where we just created inflammation. And that makes it less likely to heal fully at the site where we actually want it to heal. So creating inflammation is probably not what I think is the best way to do this. So we use products that are highly tested, highly purified, and only what's in there is what we want in there. So growth factors, anti-inflammatory factors, structural components. Sometimes when it comes to something like a joint injection, we want the Wharton's jelly product because that provides some cushioning in an otherwise uncushioned or less cushioned joint. So who can benefit from this stem cell therapy or regenerative injections such as amniotic fluid or the Wharton's jelly injections? Well, orthopedic cases are probably the most commonly seen, where we most commonly seen good benefit from that. So in my own personal case, I had a shoulder labrum tear, a slap tear, and I was told I would need surgery. I really did not want to go through the anesthesia or getting cut open or the recovery of not being able to really function with my arm for at least 6 weeks after it was not feasible with me doing what I do. And so I chose to get a stem cell injection into my shoulder, and I am so happy that I did. My shoulder 2 years later is probably 90+% better, and we've seen the same results over and over and over with shoulders, knees, hips, ankles. Those are more of the injections that we do. I just injected a Achilles tendon or calcaneal tendon yesterday, and already in the first day, significant pain improvement. So that's only going to get better. As with any treatment that I offer to patients, this has to be a discussion where we talk about the risks potentially and the benefits and what benefits do we expect and can we guarantee benefits? We can never guarantee, but we can go off of what a lot of the research shows, what a lot of case studies show, and what a lot of our patients have seen benefit with. And so it's a frank conversation about all of those things. Ultimately, we never want patients to feel pressured into this or as though this is their only option. Really, we are here to help. And if this is something that we both together decide is going to be beneficial for a patient, then I want to be able to offer it. And I'm really proud that I can offer it. If it's something that, and I've told patients this before, if it's a situation where I'm not sure that it can help, we certainly can try. There's very little risk in trying, but it's an investment. And so you want to make a wise choice about how you're investing your money. To summarize a little bit here, when we're talking about stem cell therapy, we're talking about amniotic fluid injections or infusions or Wharton's jelly injections, typically into a joint or around a joint. And these tissues, these injections themselves do not turn into cells in your body. It's easy to kind of think that when we call them stem cells, but instead of the fluids or the cells that we're injecting into your body turning into actual cells, instead what they do is they're signaling cells. So initially they were called mesenchymal signaling cells or mesenchymal signaling cells. Now they're medicinal signaling cells. And so there's kind of multiple iterations of this MSC acronym, but they now officially are medicinal signaling cells. And they actually signal for healing in the body. Our body has the innate capacity, the wonderful created capacity to heal. And so what these injections do is turn up the volume on your own body's healing, modulate the inflammation to create an environment for healing, and also modulate the immune system to create a perfect environment for healing. So all of those things together then to help regenerate cartilage and muscles and ligaments and other tissues that need repair and regeneration, and then also modify that immune and inflammatory response. If you still have questions about this, or maybe you're wondering if this therapy could be helpful for you, for your arthritis in your knee or your torn labrum like I had, please give us a call. We do free 15-minute discovery calls for our patients. Again, I want to make sure that I select the right patients to be able to help the highest amount of people that we can and get the best results that we can. It feels good for me too when we get good results. So it feels good for you as the patient to be healed, but it also feels really good for me to be able to help my patients in those ways. So you can book your free 15-minute discovery call on our website, nourishhousecalls.com, and I look forward to speaking with you.